So, the psychological aspect. When you hear you are positive, I don't think there is anything that can prepare you to deal with the fact that how can you be positive? That's the first question. First thing you ask yourself, କିଏ କାହା ସାଙ୍ଗରେ ଥିଲି ମୁଁ କେମିତି ହେଲା ମୋର positive? So I asked myself, I said, very calmly, I said, okay, ki mo sangre ki kemti exposure hai paribo. So there were two possibilities. The first possibility was my daughter is going to school. She can be a carrier and she might not be positive and no, asymptomatic. That is one possibility that I thought would be. Then I thought the next possibility would be I have had nurses and therapists um, go and see two acutely positive patients that had just come from the hospital, and they, again, they could also be a carrier even if they have all the PPE. And I got very worried, not only for myself but for them too. But then the good thing about us is, as an agency, since we had to do आमको प्रत्येक वीक्रे टेस्ट करवाको निहाती दरकार थिला, तो सेही लगी आमे बंची गलु बिकज आमर अर्ली डिटेक्शन हो जाए एंड ट्रीटमेंट आप शीघ्र आपण कर पारिबे. So then I came home and I got a little nervous. So these days from Friday, Saturday, Sunday, Monday, Tuesday till Tuesday morning, I didn't care. I'm like, okay, थंडा ହେଇଛି ठीक ହେଇଯିବ. ତାପରେ ଯେତେବେଳେ ଗୋଟେ ପଜିଟିଭ କହିଦେଲେ ବାସ୍ ମୋତେ ବଡ଼ ଡର ଲାଗିଲା. ଖାଲି oh my god, this is my 5th day and things are going to go down. Then I talked to myself, ଯାହା ହବ ଦେଖାଯିବ. I'm going to take one day at a time, and truly speaking, even till today, I decided I'm not going to stress myself out, because two things. ଗୋଟେ ତ ଆପଣଙ୍କର ହାର୍ଟ ରେଟ୍ ବଢ଼ିଯାଏ ଯେତେବେଳେ ଆପଣ anxious ହୁଅନ୍ତି. ଆଉ ଗୋଟେ ହୁଏ କି the fear of unknown grips you and you cannot focus on healing yourself. So then I decided, no, with all the things I have done in prevention, I'm going to apply that. And all the program I have always talked about positivity and how to overcome this with your positive thoughts and with proper diet, with proper alternative medicine. I said, I'm going to experiment that on myself. So then my journey started off actually going through the process and healing. So in the journey, briefly Mukoiduchi, I know everybody is different, and this is a disclaimer. Please don't use it as your treatment protocol, because I am not prescribing this. I'm just sharing what helped, and it could help you and it could not, but always follow your physician, your primary care. ଆପଣଙ୍କର जो physician अछंती, doctors अछंती, तांको संगरे कथा हुअंतु. ମୁଁ as a COVID जोधा मु आपन संगे शेयर करछि जोटा मते काम देला, किंतु एटा को यूज करंतनी एज अ ट्रीटमेंट की मु सुनिली मु सेटा करबी. आमे बहुत आमे ए ह्यूमन बीइंग, वी डू दैट, बट इट्स गुड टू शेयर. सो मु कहि दउछि मु कोन कोन कली. So I started taking arsenicum album. Before that, I also, my friend introduced me to something called thymolene, which I take every week. Tinita pellets diyanti se mate कहथिले नेबाको. And then there is something called bryonia, जोड़ा मोर जो तंटी काटुला खास हेबाकू माने पूर्व स्टेज. So she had told me, if you start having throat issues, take bryonia. So I took bryonia, and then for pain, aches and pain, I took Anika montana, which I'm very used to. Anika montana seta both regularly samaste use karanti. It's like a Tylenol in allopathy. In homeopathy, Anika montana is a wonderful medicine when you have pain, like muscle pain or acute pain of some kind. So mu seta mu use kali under her guidance, and sure enough, it's been a scary but a very steady bhalla hebar dhire dhire from the 5th day onwards. ମୁଁ मेंटेन कली माने मोर जो जो सिम्पटम थिला सबु थिला, किंतु सबु जिनस मेंटेन हेके रहला. ओनली थिंग मोर जोटा सिग्निफिकेंटली मु जानी पारली सेटा हैला मोर टेस्ट आउ नोज रो स्मेल से दीटा पड़ेला. से इवन नाउ आई थिंक आई एम गेटिंग इट, बट मु बुझी पारनी. माने मु खाइला बेले किसी जଣା पड़े कौन से जिनस खाइबा को मु खाई दउछि काहे कि ना मते खाइबा को पड़िबो, किंतु से जो टेस्ट ସେ ଟେଷ୍ଟଟା ପଳେଇଛି, ଏବେ ବି ପଳେଇଛି, ଏବେ ବି ମୁଁ ଶୁଙ୍ଗି ପାରୁନି। ସୋ କେମିତି କଲି କ'ଣ କଲି ଡ୍ୟୁରିଂ ଫ୍ରମ୍ ଦ 5th ଡେ ଅନୱାର୍ଡ଼ସ୍ ମୁଁ ନିଜକୁ ଏଇ ରୁମ୍ରେ ଆକ୍ଚୁଆଲି ଫ୍ରମ୍ ଦ ଡେ ୱାନ୍ ସିନ୍ସ ଆଇ ୱାଜ୍ ଦିସ୍ ଇଜ୍ ମାଇ ବେଡ଼ରୁମ୍ ତ ମୁଁ ନିଜକୁ ଆଇସୋଲେଟ୍ କରିଥିଲି ମାନେ ପାର୍शियली କରିଥିଲି ବଟ୍ that day I decided when I was positive, I decided I'm going to strictly follow what I have preached. तो ମୁଁ ନିଜକୁ ଏଇ ରୁମ୍ରେ ରଖିଲି କବାଟ ବନ୍ଦ ସବୁବେଳେ ଖାଇବା ମୋର ହଜବେଣ୍ଡ ଆଉ ମୋ ଝିଅ is 16 my husband is he's a good cook you know he can manage ଆମେ ୟୁଏସ୍ରେ ରହୁଛୁ ଆମେ ସମସ୍ତେ ସବୁ କାମ କରୁଛୁ ମାନେ I drive I do oil change and in the similar tone he does all the housework when needed I usually do cooking but once in a week he will do cooking for the kids and for me so we were kind of independent but not really because certain things ଯେତେବେଳେ ହଠାତ୍ ବେଶୀ କାମ ପଡ଼ିଯାଏ ଜଣକ ଉପରେ because he also we both share the same business so ମୁଁ ବହୁତ ସାରା decision making ତାଙ୍କ ପାଇଁ କରେ in the office and he doesn't have to worry about the clinical part so everything fell upon him so but I have to say he's a very patient man. He's more patient than I am. I'm very much on the go kind and he's very patient, calm and caring so that part helped because if you have a working couple who's constantly on the go ଆଉ ହଠାତ୍ ଜଣଙ୍କର ଦେହ ଖରାପ ହେଇଯାଏ same business it just falls off ମୋର ଯୋଉ ଅଫିସର staff they have been very they are very supportive ସେମାନେ ପେପର ୱାର୍କ ହରିକା ଆଣିକି ଦେଇଦେଲେ ଆମର ଯାହା ଯାହା ଟାଇମ୍ ବାଉଣ୍ଡ ଜିନିଷ କରିବା ଅଛି ବାହାରେ ଆଣିକି ରଖିଦିଅନ୍ତି ତାପରେ ସେମାନେ ଅଫର୍ କଲେ ଖାଇବା ପାଇଁ କିନ୍ତୁ ଆମେ ଦୁଇ ଜଣ ତ ଟିପିକାଲ ଇଣ୍ଡିଆନ୍ ଖାଇବା ଖାଉ ତ so I said thank you especially when you get sick you want to eat your mom's food so I stayed home the few things I did say homeopathic ତାପରେ ଖାଇବାରେ ଆପଣଙ୍କର କାଢ଼ା କୁହନ୍ତୁ I used to make kada my husband made kada too ଅଦା ଆଉ ତେଜପତ୍ର ଆଉ black pepper and ଡାଲଚିନି ପକେଇକି ସେଟା ଫୁଟେଇ ଦେଇକି ତାପରେ ସେଥିରେ ଟିକେ ହାନି ମୁଁ ହାନି ଖାଏ every day I was eating honey ଖାଇଲି ସେଟା ପ୍ରାୟ ଦିନକୁ 2 ଥର 3 ଥର ଖାଏ ତାପରେ ତା ଛଡ଼ା ମୁଁ ଖାଏ ଗରମ ଚା ଅଦା ସାଙ୍ଗରେ ସେଟା ବହୁତ ଭଲ ଲାଗେ ତଣ୍ଟି ପାଇଁ ଦିନ ଯାକ ଗରମ ପାଣି ଆଉ ଷ୍ଟିମ୍ 3-4 ଥର ଷ୍ଟିମ୍ ମୋର ବଡି ବହୁତ ଗରମ ହେଇଯାଉଥିଲା ଭିତରୁ ଇଣ୍ଟରନାଲି I used to feel very hot I don't know why fan ଚଲାଉଥିଲି ଏତେ ଗରମ ହେଉଥିଲା I think part of the reason is even though it's cold here ଏଠି ଥଣ୍ଡା କିନ୍ତୁ ଏଇ ଯେଉଁ ମସଲା ଗୁଡ଼ାକ ଗରମ ମସଲା ଗୁଡ଼ାକ ଏତେ ଖାଇଲେ ମୋତେ ଲାଗେ ଦେହ ଭିତରୁ ଗୋଟେ ଗରମ ବାହାରେ that is a lot of people are not used to it and especially in India ଏବେ ତ ଆପଣଙ୍କର ବେଶୀ ଥଣ୍ଡା ପଡ଼ିନି ତ ଯେତେବେଳେ ସେମାନେ କହନ୍ତି କାଢ଼ା ପିଅ 2 ଥର 3 ଥର ମୁଁ ଜାଣିଛି ବହୁତ ଡିଫିକଲ୍ଟ ବିକଜ ଇଣ୍ଟରନାଲି ଇଟ୍ ଜେନେରେଟ୍ସ ହିଟ୍ ତାପରେ ଯେହେତୁ ମୁଁ ଈଶା ୟୋଗା କରୁଥିଲି ଆଗରୁ ମୁଁ ଚାଣ୍ଟିଂ କରେ ଗୋଟେ ଚାଣ୍ଟିଂ ଅଛି ଶିବଙ୍କର ଚାଣ୍ଟିଂ କରେ ଆଉ ଦେବୀଙ୍କର ଚାଣ୍ଟିଂ କରେ ଏବେ ନବରାତ୍ରିରେ ମୁଁ ପୁରା ହୋଲ୍ 10 days ମୁଁ ଚାଣ୍ଟିଂ କରିଥିଲି ଆଉ ସେତେବେଳେ ସେଇ ଟାଇମ୍ରେ ହିଁ ମୋ ଦେହ ଖରାପ ହେଇଥିଲା କିନ୍ତୁ ତା ସତ୍ତ୍ୱେ ମୁଁ ଚାଣ୍ଟିଂଟା କଣ୍ଟିନ୍ୟୁ ରଖିଲି I think that helped my lungs ଯେତେବେଳେ ଆପଣ ଜୋରରେ ଉଚ୍ଚାରଣ କରନ୍ତି ଶିବଙ୍କର ନାଁ କିମ୍ବା ଦେବୀଙ୍କର ନାଁ ଯେତେବେଳେ ଉଚ୍ଚାରଣ କରନ୍ତି ଆମର ସଂସ୍କୃତରେ ଯେଉଁ ପ୍ରକାରରେ ୱାର୍ଡ଼ର କମ୍ବିନେସନ୍ ହେଇଛି ଯେଉଁ ପ୍ରକାର ଆମର ବନା ହେଇଛି ସେ ୟୋଗିକ୍ ସାଇନ୍ସ ର ବହୁତ ମହତ୍ତ୍ୱପୂର୍ଣ୍ଣ ଅଛି ବିକଜ ସେଇଟା ଆମର ଚକ୍ର ଗୁଡ଼ାକୁ ଷ୍ଟିମୁଲେଟ୍ କରେ ସୋ ଇଭେନ୍ ଇଫ୍ ୟୁ ଆର୍ ସିକ୍ I feel like if you do a practice that you've done for couple of years before ସେଇ ଜିନିଷଟାକୁ ଆପଣ ବନ୍ଦ କରନ୍ତୁନି କାରଣ ୟୁଜୁଆଲି ସାଇକୋଲୋଜିକାଲି ଲାଗେ କି ଯଦି ମୋର ଦେହ ଖରାପ ମୁଁ କରିବିନି और ମୁଁ ସ୍କିପ୍ କରିଦେବି ମୁଁ ସେଇ ଜିନିଷଟା ମୁଁ ଆପଣଙ୍କୁ କହୁଛି I have a friend so we have been doing it together so we kind of encouraged each other and said we've been trying to do it and when it becomes a practice it's like driving a car or drinking tea in the morning so ସେଇଟା ନ କଲେ ମୋତେ ଭଲ ଲାଗୁନଥିଲା so I made it a point and besides science ଅଛି କି ଯଦି ତମେ ନିଜର ଦେହଟା ନିଜର ଲଙ୍ଗସଟାକୁ ଷ୍ଟିମୁଲେଟ୍ କରିକି ରଖିବ ତାହେଲେ ସେମାନେ as such ଏମିତି କହୁଛନ୍ତି କୋଭିଡ଼ରେ ତମେ ବ୍ରିଦିଂ ଏକ୍ସରସାଇଜ କର ସୋ ବ୍ରିଦିଂ ଏକ୍ସରସାଇଜ କରିବାକୁ କିଛି ନଥିଲା ମୁଁ ଅନୁଲୋମ ବିଲୋମ ବି କରୁଥିଲି ଦେନ୍ ମୁଁ ଈଶା ୟୋଗାର ମୋର ସବୁ ଉଚ୍ଚାରଣ ଦେବୀଙ୍କର କବଚ ଦେବୀ ପ୍ରାର୍ଥନା ଦେବୀ ସ୍ତୁତି ସେଇଟା କହୁଥିଲି ଜୋର ଜୋରରେ କହୁଥିଲି ଆଉ ୟୋଗା ୟୋଗା ଯୋଗେଶ୍ୱରାୟ ଗୋଟେ ଚାଣ୍ଟ ଅଛି ସେଇଟା କହୁଥିଲି ଆଉ ମୁଁ ଦେଖିଲି ଯେତେବେଳେ ମୁଁ ସେଇଟା କହୁଥିଲି I felt good actually. I felt like energetic. I felt like I'm going to psychologically भी मते लागिला कि ମୁଁ ଏଇ ଜିନିଷଟାକୁ overcome କରିବି. There is no ifs and buts about it. I have to overcome this. Um, it's a viral thing, and I have to. What can I do? So I kept on constantly thinking.